We estimate that there are currently around 26,000 people with Covid-19 in Scotland. I stress these are estimates, but that is still too high a number for us to consider that the virus is under control. I've also spoken before about the vital importance, the critical importance of keeping the R number below 1. Now, we know the R number is higher in care homes, but our best estimate is that the R number in the community is currently between 0.7 and 1. But we cannot be sure that it's not closer to 1 than 0.7. There's also some evidence that the R number in Scotland might be slightly higher at this point than in the rest of the UK, although the modelling that is based on is subject to a high degree of uncertainty. But in any event, the R number is not yet far enough below 1 to be confident that any changes to current restrictions wouldn't quickly send it over 1 again. And if that happened, the virus would start to increase exponentially again. That could overwhelm our health service, force us to reimpose restrictions, and it would lead to many more deaths. Now, as an illustration of this, we include in the paper a chart which is based on recent Danish data, and we are looking at experiences in other countries all the time. But what this chart suggests that if we were to fully reopen nurseries and primary schools now, the most likely scenario would be a resurgence in the virus that would overwhelm our hospital capacity in a matter of weeks. Now, the fact is that any easing of restrictions, whenever we introduce them, will have an impact on the R number. But if we get our baseline lower than it is now, we will have more headroom to cope with that and be able to avoid outcomes like the one I've just highlighted.